Here's Everyway Woman.
Welcome to Everyway Woman. We're excited to have Dr. Chen, from the Director of Breast Radiology at Breastlink, here to answer all of your questions. Thank you for being here, Dr. Chen.
Thank you for having me.
Well, tell us, what is a mammogram and why do we need one?
A mammogram is simply an x-ray of one's breast. Mammograms are very important. Currently, they are the gold standard for early detection of breast cancer. They are the best way for a woman to detect a breast cancer if it's present early on.
And do they hurt? I hear that they hurt because they squeeze your breast so tight.
So they're definitely uncomfortable, and they should be. If it's not uncomfortable, then one has to question whether or not enough pressure has been applied. A mammogram basically consists of flattening the breast in between two plates. And the plates press on your breast, they compress your breast to spread out the breast tissue. And it does need a certain amount of good compression, because the more compression that is applied, the better the picture that can be taken, and the less radiation the woman is exposed to. So it's very important. So it actually should feel somewhat uncomfortable, but I would think of it as it's a test that one receives only once a year, and it could save your life.
How long does it last?
The compression itself between the plates only lasts a few seconds, but the actual screening mammogram itself takes about 15 minutes.
And you mentioned radiation. What about radiation?
So the modern mammogram does not give any radiation to the woman that would significantly increase her risk for breast cancer. Of course, there is radiation applied, but there are very strict guidelines. The mammography equipment currently is very safe, and if it's given to the right age group, which is defined by clear standards, it should not relay any significant increase for development of breast cancer later on in life.
And what is that age group? I'm sorry. What is that age group you mentioned that should start the screenings?
So all women at the very latest should start screening mammogram at age 40. There are a few subsets of women who should actually start earlier than the age of 40. And for example, I'll just give you a few examples. It may be a woman who's had a first-degree relative with a family history of breast cancer. So that could be a mother or a sister diagnosed with breast cancer early on, maybe in her 40s or even in her 30s.
So women shouldn't be afraid of the radiation starting younger if they have to.
Exactly. The benefit of the mammogram will outweigh the risks. And if you want to think about it in an easy way, the amount of radiation that a woman receives from a mammogram is roughly equivalent to a woman stepping on an airplane, on a commercial jet, and flying from California.
That's a good perspective. That's a very good perspective.
To New York.
Reassuring. Yes, very much so.
And how long does it take to get the results?
So facilities are required to give a written report of a woman's mammography results within 30 days.
Okay. And what about, my mom had breast cancer. Should I start doing a screening anytime earlier, or should I still wait till 40?
How old was your mother when she was diagnosed with breast cancer?
She was in her mid-50s.
And was she the only person in your family who's been diagnosed with breast cancer?
As far as I know.
Okay, so you have one relative, it's your mother, and she was diagnosed in her mid-50s. So unless there are other indications in you, which you haven't shared with me, because there are other risk factors that we may need to consider. But if that is your only risk factor, then yes, you would start screening at age 40. If, however, your mother had been diagnosed with breast cancer at age 42, let's say, for example, then you would start a screening mammogram 10 years prior to that age. So you would start a screening program at age 32.
Now, let me just ask you, I'm kind of a little complacent that you're speaking to me right now, because I've kind of just figured, my mom got breast cancer because she was taking hormone replacement therapy, and I'm like, well, I'm not at risk because it was due to that. I'm just not going to do hormone replacement therapy probably. But, do I need to worry about it?
Absolutely. In fact, every woman needs to worry about it, because the two strongest risk factors for developing breast cancer are simply being female and aging. And all of us are female, and all of us, unfortunately, will age.
I'm good.
So So please erase that thought from your mind. We're all at risk, unfortunately. 1 in 8 women will be diagnosed with breast cancer, and there are how many of us here? There are 5 of us, and there are 3 more women in the office here, and so
boy.
Unfortunately, if you think about that, one of us will be affected by breast cancer. So we need to be very diligent in getting a mammogram every year, starting at age 40, unless there are reasons to push that age to a younger age.
Oh boy, when you did it that way, oh my gosh, I know goosebumps.
I know,
start thinking of it in people versus numbers.
It's very personal. We need to realize that, yes, it can happen to ourselves, it can happen to our colleagues and friends, our relatives, anybody that's female, as I said.
And you mentioned other screening options, maybe ultrasound. Is that as good as a mammogram, or?
So that's a wonderful question. Mammography remains the gold standard for screening for early breast cancer. It is absolutely the best tool that we have out there. Is it perfect? Absolutely not. Is it 100%? No, but nothing in life is 100%. So if one has other indications or other risk factors, after a mammogram, we can have an adjunctive study, another exam to complement the mammogram. And those include screening breast ultrasound, screening MRI, depending on the patient's personal risk factors and personal history.
So we have a lot of options for screening tools.
Yes, we
fantastic.
do.
Well, thank you, Dr. Chen. I mean, you really woke me up here.
Thank you for having me.
Thank you for that. And I hope a lot of our viewers are also, waking up and realizing we have to take care of ourselves. For more information on Dr. Chen, you can go to breastlink.com.
Thank you.
Stay with us. We'll be right back with more Every Way Woman.